This is Michael Smith of MedPage Today. I'm here in Montreal at the meeting of the American Society of Bone Mineral Research, speaking with Dr. Richard Eastell of the University of Sheffield in England. Dr. Eastell is reporting on new ways of measuring bone turnover in patients with osteoporosis. Dr. Eastell, what did you actually do? What did you look at?
Yes, well, we've been carrying out a research study, a clinical trial of zoledronic acid for the treatment of osteoporosis, and we found that the treatment resulted in a reduction in fractures of the spine, hip, and other sites. What we wanted to know now was whether or not we could find out whether individual patients are responding to treatment. And the way we did that was we measured bone density of the hip and a biochemical marker of bone turnover that we call P1NP, and we made these measurements after 1, 2, and 3 years on treatment. And what we were able to conclude was that the bone marker was actually better than the bone density at looking at the link between the treatment effect, in other words fracture risk, and the measurement, in this case bone markers. So a patient who had a low bone marker had a particularly good response in terms of having a low risk of having a fracture.
I see. So the relationship is if you have low levels of this marker of turnover, in other words the bone's not changing much, then that also correlates highly with the risk of fracture.
Exactly right. Exactly right.
Most doctors, many doctors, look at bone mineral density when they're dealing with following patients. Should this be replace that as a marker, or what are the clinical implications of this?
Yeah, it could be regarded as supplementary. One of the beautiful things about the bone markers is that they change very quickly on treatment, and so by 3 to 6 months after starting the treatment, we see the full effect of these, whereas it takes 2 or 3 years to have a good increase in the bone density. So it allows you to have a quick understanding as to whether the patient in front of you is benefiting. And in this study, if anything, it shows that the bone marker is providing more information. So I think certainly it's another tool that doctors can have to better understand whether their patient is benefiting from the treatment.
Is this a difficult test to do?
No, it's very straightforward. It can be measured in clinical chemistry laboratories using automated analyzers or standard assay techniques. We measure these things routinely in our patients with osteoporosis in my clinic in England.
I see. Thank you very much. I'm Michael Smith, MedPage Today.